Hello, my name is Eric Ford. I'm a medical physicist and a professor at the University of Washington in Seattle. I'm going to describe a project my team and I are involved in. This is to deliver low-cost radiotherapy devices for cancer treatment. So if you don't know what radiation therapy is, let me stop for a minute and explain that, and then I'm going to talk about the device. All right, so here we go. So here's a case study. Here's a patient with a lesion from metastatic cancer in the vertebral body. You can see it here. This is very painful for this patient, but we can treat this with radiation. So here's a treatment, 8 gray, delivered over 3 days, and this patient leaves and the pain will be gone. So this is a palliative treatment, not meant to cure the patient, but it avoids all the problems associated with the delivery of a narcotic or an opioid for this patient. Very common use of radiation. Here's another way we use it. Treating this patient who has head and neck cancer, treating the tumor volumes here, staying away from the cord and staying away from the salivary gland, which preserves salivary function and dietary status. So this can be delivered in a very cost-effective way and avoid toxicities. So these are the main advantages. Non-invasive, allows sparing of organs, low risk of toxicity, and overall the costs are low once you're going with radiotherapy. It should be utilized according to various studies at a very high rate, and you look at cancers that are represented in low middle income countries, and you see the utilization rate should be around 80% or so. That's how we use it when the technology is available. But the access is not good across the globe. There are many machines in North America, almost 4,000, but in the continent of Africa, there are about 300 such machines. And per population, the numbers are also not good. In addition to that, there are staffing needs, and here you'll see the great undersupply of medical physicists. It's one of the job description of people that are needed to run and control these devices. So this drives the access to technology, the upfront capital costs, the staff availability, the reliability, and you see that play out here. In low-income countries, the equipment is a big percentage of the cost. Also, the staff, even if the salaries are available, the staff is often not available. So that brings us to the requirements. We need devices that are reliable, simple, efficient, and as a result have reduced staffing requirements. However, they also need to be able to deliver high precision radiation therapy. The devices we have now use many moving parts, lots of equipment that can break down. So this is the crux of our project. This is something that's funded by the National Cancer Institute under the Affordable Cancer Technology Program. And our project is partnership with the All India Institute of Medical Sciences in New Delhi and a commercial partner, Panacea Medical Technologies in Bangalore, India. We're designing a system that's novel. It's a ring-based compensator system to deliver intensity modulated radiation therapy. It works by using printed plastic shells, 3D printed, and these shells are then filled with tungsten beads, which are reusable. The radiation beam goes through this, and it's attenuated just where it needs to be attenuated, and it delivers a precise radiation dose. These are placed in a ring around the patient, and you treat through each of these compensators, which is an extremely efficient way to do this. We've run some simulations. This is a plan of a patient actually treated on a current radiotherapy device in the clinic, and this is our device in the bottom, and you can see you achieve the same kind of sparing that you do in the clinic. But what's interesting is this is on the bottom, this is done with a cobalt-60 beam, and yet the treatment times are very short. So this has never been possible before, and it's done with very few moving parts, very simple device that should provide increased access to this really important technology. All right, with that, I'd like to thank you. I look forward to further discussions that we'll have around this soon. Thank you.